All right, well, good morning. I have the pleasure of introducing the session. I know we'll probably have a few more coming in. For a treat with two fine gentlemen that I'll introduce you in just a minute. But before I do that, my name is Dan Cummings. I'm one of the professional service veterinarians with Idaho. It's always a privilege for us to support this meeting and the Beef Repro Task Force because of the obvious importance of reproduction in the cow-calf operation. So it's a privilege for us to be here. Let me quickly introduce a couple of my colleagues in the back at BI. Dr. John Davidson, if you'll stay and give us a wave. So you may know Dr. Davidson. He's our Associate Director of our Beef Cattle Veterinarians. And then Mr. Scott Porter, who's in Texas as one of our regional managers. So if you haven't had a chance, go by and see those gentlemen at the booth and ask some questions, inquire. We have a suite of products that I think can be very beneficial for herd health and repro synchronization and all those sorts of things. So if you do get a chance, go by, and Mr. Todd Huber just walked in the room as well. He's one of our senior sales professionals. So glad for those guys to be here, and please feel free to interact with them, have some discussion, and they'll try to guide you down the right path. So without further ado, one of the things that we really want to focus on in this session is some interaction, some discussion, because we know there's a lot of questions around herd health and biosecurity, biocontainment, which Dr. Jones and Dr. Gale will attempt to answer. But it's important for us to hear your experiences, maybe some of the challenges you deal with in working with producers, veterinarians, et cetera. So certainly feel free to raise your hand, ask questions. I'll try to help foster some of that as the moderator. So we encourage some robust discussion. In this session, we're going to talk about how do we achieve reproductive security, and what does that really mean from a biosecurity standpoint? How do we protect our herd in order to have the best reproductive outcomes? And obviously fertility is impactful in that realm, and both of these gentlemen are going to go through that. So I'm going to introduce them both and then turn it over to Dr. Jones. Dr. Lee Jones, who is on the Beef Repro Task Force, comes to us from the University of Georgia. He probably didn't know that I know this, but I know where Milledgeville, Georgia is, where he achieved his bachelor's degree at Georgia College. And then he got his master's from the University of Georgia, went on to vet school at Colorado State, went into private practice, has been in academia, does some consulting in industry. So a lot of experience from this fine gentleman that he'll share with you. And then secondly, with the second half of the session, Dr. Dan Gale comes to us from Canton, Missouri, where he's a practice owner, practitioner at Canton Veterinary Clinic, does some research as well, and really is going to bring the practical application of how he works with his producers and his practice and setting up some of these biosecurity measures so that we can protect reproductive health. So without further ado, I'm going to turn over to my friend, Dr. Jones.
Thank you, Dan. That was impressive. Got all that memorized, and you did great. Thank you, and thank you for that kind introduction. It is great to be here. COVID took a couple of years away from us, and I was talking to somebody out there that I'd seen pre-COVID, and of course, the older I get, things happened just yesterday, and they were really more like 3 or 4 years ago, right? But anyway, so it is something that this is a great topic. As a veterinarian, we do focus a lot on bugs and biosecurity. Put things in perspective, and I'll talk a little bit about this through the talk. Most herds, if they're well managed and they're well run, they don't see impact of infectious disease on reproduction. However, as veterinarians, we deal with hundreds of herds every year. So we get to see it on a frequent basis where a producer may go years without ever seeing an outbreak or ever seeing an impact of a bacteria, an impact of a virus on their herd. But as veterinarians, this is something that we deal with annually. Now, part of my role too is I'm the field investigator with a diagnostic lab. So then I get to even see more of this, and I get to investigate a lot of these cases a bit more in depth. And so hopefully we'll bring some of that, those experiences to this talk. I am going to, Dr. Gale sent me a text late last night. He said, hey, I'm stuck in St. Louis. So I left my my slide deck kind of long. So some of this I'm going to scoot through if it's okay with you for the sake of time, because what Dr. Gale has to share from the practical level. And we both talked about this, and I've been in academia now about 12 years. So I'm going to come at it from that 30,000 foot view, and then Dr. Gale's going to come bring us down a little bit closer to home and talk about some of his experiences and things that he does in practice. I'm not going to spend any time here. You saw this with that great talk from Dr. Mercadente. But anyway, all of our resources, these are available to you. Some of these presentations will be recorded, and these will be available to you. You can go to our website and see some of these resources. And hopefully, like Dr. Mercadente mentioned, you'll become an advocate and you're really excited about going out and AIing cows and telling your neighbor. So Dr. Wiltbank, over 50 years ago, mentioned that what we need to do is we need to increase the proportion of cows bred the first 21 days of the breeding season. We heard that in the opening session. We need to increase conception rate first service. We also need to increase pregnancy retention through first service, and we need to decrease the losses at or near birth. How are we doing so far? 50 years, these were the goals, and I think we're still trying to push that, and in some cases, maybe we've achieved that, but these are still worthy goals even today. So fertility is getting cows pregnant. That's first priority a cow-calf producer. All right, winning a healthy calf obviously required. If we don't win a calf, reproduction didn't happen. It doesn't matter if the cow didn't get bred. It doesn't matter if she got pregnant and lost it. She doesn't get any points for that. She doesn't get any points for calving a calf and then losing it shortly after birth. She only gets points if she wins a calf. So reproduction requires that entire 15 to 16, 17-month period, and if it doesn't happen, we don't have anything to show for it. We have plenty of expenses. We don't have a paycheck to cover those expenses. You know, for owners, fertility is our highest priority, but for the cow, it's the lowest priority, isn't it? Everything else is going to come first. So any management activity recommendation as a veterinarian, I need to make sure that I am not putting tension in conflict with fertility. So herd health, the goal of herd health is improved fertility. Nutrition, many of you may know about Hippocrates, and he said all disease begins in the gut. In fact, all health also begins in the gut. We know that. We know that we can affect a lot of human health with the better nutrition. We can also affect cow health with good nutrition. Environment, there's a lot of things in the environment. This is a Brayford heifer in my pasture. She happens to be in a pasture that has a creek, and sometimes that creek, if hadn't been a lot of rain, that creek gets stale and that water gets stagnant. And so we've lost calves in this pasture, actually lost pregnancies in this pasture. But there's part of that's the cost of running cattle, right? We're not going to change the water flow in our pastures. We're not going to change sometimes forages in our pasture. We're not going to change a lot of things. It's just the environment that these cattle have to produce in. Reproductive efficiency, it's a consequence of my cow herd body condition. Good breeding soundness evaluations on our bulls, heifer selection. And then we get down to prevention of infectious diseases. Part of that's biosecurity, not letting you begin in the first place. Disease resistance, I work with that with nutrition and vaccines. I'm going to be able to build resistance toward, just a handful of diseases that I have in my vaccines. There's only about 4 or 5 things that I can build resistance to with a vaccine. So most of our resistance is going to have to come through the innate immune system from the animal. And then timely investigation and intervention of outbreaks. Once something happens, I want to put that fire out quick. It's like fires in the Midwest. If you can get to them fast, they're going to create cause a whole lot less damage. And so get into those things, biocontainment, knowing what to do, and not all bugs behave the same. It's very important to understand, as a veterinarian, I'm working with clients, and I try to help my clients understand, lepto does not behave like VVD. We talk about reproductive diseases like the overall big thing, but all of these infectious agents have different behavior patterns. And the way that I'm going to address those in my herd, it really depends on the bug that I'm working with. And so ostratasia may actually have a reproductive consequence because it delays puberty in my heifers. But we don't, that's just a side of things. We don't really talk about ostratasia as having reproductive effects. But there's a lot of these things that have secondary effects And then things like BVD, listeriosis, lepto, those kind of things behave very, very differently from one another. My control procedures in my herd is going to be, I have to adjust accordingly. So what are the risk factors for infertility or pregnancy loss in the cow? Obviously, she's not cycling, she's not going to conceive. You know, the genetics, you know, if you're dealing with eared cattle, this is part of that pasture, you can see cypress trees in the background. The genetics, these animals are going to hit puberty a little bit later in life. Nutrient deficiencies, and I did say nutrient deficiencies. Nutrition, we typically think in body condition, we think mostly about energy, not protein. A lot of people talk about their hay quality as protein, but really it's about the digestible nutrients, TDN and energy, but there are also some nutrient deficiency. Trace metals can lead to failures. There's a poster out there about a zinc signature on bulls. So we do know that some of these trace metals are really important toward conception. Infectious diseases, reproductive diseases, you know, pink eye running through a group of heifers can actually reduce conception rate, reduce overall pregnancy rate. And then of course, stress, heat stress, environmental stress. We actually had some long-term effects from Hurricane Michael that came through about 4 years ago in 2018, I believe it was. And we ended up with some herds that really spent some time recovering from Hurricane Michael and some of the damage there. So there's certain things that play a role: pregnancy loss, nutrition, environment, and then of course infectious causes. And then pregnancy loss, once it's established, then infectious causes probably increase as a relative risk factor for that. So fertility is an iron nothing, you know, for the cow, but it's certainly a spectrum for the herd because I have a lot of factors going on there. Any one of these things can cause infertility in a cow. But oftentimes I have a multitude of things that are actually affecting fertility of the cow herd. And then factors related to the bull. This is a young bull out with some older cows. You know, just looking at, I might have a bull that has a lot of enthusiasm for breeding, but he might be down on the pecking order. He might pass, he might have the better of the BSE scores, but he's lower on the pecking order. Poor semen quality, motility, morphology, other factors, even in this case here, breeding experience. So we're not going to ask that young bull to cover a whole lot of cows. Injury. This bull here has an injury to his glands. Actually, when I did check him out, he was ejaculating through the side, through an opening, an orifice that caused, so he probably wasn't going to be breeding very many cows. The span picture at the bottom is a bunch of mucus reflexes, just common sign of heat stress. Heat stress can be mitigated through antioxidants within the epididymis. But so just different things, trace mineral deficiencies, some genetics, pregnancy, you know, infect a cow with pathogen. Bulls can breed cows and put more than just sperm cells. That can be trick, that can be lepto. Vibrio, VVD. There have been cases of older bulls that were actually PI, persistently infected with VVD, other things. So the bull is certainly a lot more important necessarily than the single cow being infertile, because the bull, if he's infected or infertile, is going to affect the life and the life trajectory, the projection trajectory of a lot more cows than just one. So biosecurity is procedures intended to protect humans or animals against disease or harmful biological agents and risks. So what are the herd management practices for biosecurity? Isolation, closed herd. There really isn't such a thing unless somebody's doing completely AI or embryo transfer. There's really not much of a thing called closed herd. If you're buying bulls, there is a window for an opportunity to bring something in. But you know, biocontainment. Do I have a place? Do I have pens or pastures that I can separate sick animals? Do I have a quarantine and test practice? Do I have a management procedure? Do I have a place where I can bring animals and hold them? You know, when animals are transported, their stress goes up, the opportunity for shedding of any organisms that they might be carrying increases. So certainly at a time where I want to keep them separated, I do at least 30 days and test and observe. Traffic control. Do I have a way of controlling things? We have a lot of day workers in the southeast, and you know, when they show up,
Some really good cowboys, but sometimes they could potentially bring something that you don't want. Do they show up clean? You know, did they clean their equipment before, being from the herd the day before? You know, when I was brand new in the 90s going out and practicing, I'd show up clean, and an old timer would say, "You must not be very good, you're pretty clean." You know, so that was not really mentality 30 years ago, what it is today. You know, it's expected for us to be clean, to show up with clean boots, clean coveralls, clean equipment. You know, those days of being dirty, as a sign of being good and busy, those days are gone. So I need to make sure that I show up clean, and definitely when the students go with me, they hear that lecture. They hear that lecture. Sanitation, you know, are we cleaning up our equipment? You know, we use equipment to load feed, but thoroughly clean if necessary. When I was in graduate school in the 80s at University of Georgia, the farm crew cleaned out an old room that had some phosphates and stuff, and they threw those out. Well, they used the bucket, then they did not wash the bucket out, okay, before loading silage. They went to the pasture, fed the heifers first, and there were 5 of 8 heifers that died. And they happened to be ET results or recips. But that was an example early on for me. They said, hey, you know, make sure that all of the people, even the people on my ranch that don't necessarily work with cattle, if they do anything, make sure they understand what the risks are. So a quarantine and test, basically, you know, separation for the resident herd for at least 3 to 4 weeks, ideally 30 days. This includes show animals too. We do work with people that show cattle. So, you know, those show animals that go to those shows, they interact with what? Another, directly and indirectly, another 50, 60, 100 animals potentially. There was a guy in Florida, as a dairyman, he told me a story where he actually loaned a bred heifer, Holstein heifer, to a kid to go show, and the kid took the animal to a show. Somehow it was exposed to BBD, and then when that heifer calved, that calf was a PI. It's the only PI they've had born on the place in 20 years. But that has happened. So you can bring that stuff home. So watch for signs of disease, test new additions. What kind of things do you want to test for if they're not already tested? BVD for sure, bovine diarrhea virus, anaplasma. Anaplasma is wreaked havoc. It's going through, we see it a lot in Georgia. There's a risk of introducing anaplasmosis, or there's a risk, oops, got a spelling error. There's a risk. Yeah, it's interesting how those things show up better in presentation than when you're actually typing it. But anyway, there's also a risk of bringing a naive animal into an endemic herd. Right? A story about that, but for sake of time, I don't have to go. Yonis, understand the test limits if I'm going to do any testing for yonis there. Leukosis virus, Dan and I visited about that. Leukosis virus is pretty much across the board. I've been an ET since the 80s, and so I think we probably infected some purebred herds using Holstein recips with yonis and leukosis virus. But if you're planning on exporting, you're planning on doing some things in the purebred herd, you might want to implement some leukosis control. And then of course trick. If I'm getting in any kind of used bull, we're going to definitely test 3 times at least for trick to see if that bull's got it. Ideally, we only want to buy virgin bulls, but we do know sometimes those virgin bulls are not, in fact, virgin bulls. And it's a good time to vaccinate and do new additions. So some of the disease pathogens that affect, so a good rule out list. If I'm investigating something, I want to make a list of things I want to rule out. And that's infectious disease. That could be trick. Could be lepto, vibriosis. I don't see that very often anymore. I don't think we've ever diagnosed it in the 12 years I've been at the Tifton Veterinary Diagnostic Lab. Neospora, anaplasmosis, the viral agents, BVD, and herpes virus. So these are the 2 viruses that we worry about. We don't worry about too much about BRSV or PI3. Or coronavirus. The less common infectious agents include Histopheles, brucellosis, because we pretty much controlled it in most places in the United States. Ureaplasma does raise its head every once in a while, and then blue tongue does as well, but 70% of the animals that we've tested at the diagnostic lab have been blue tongue positive. Blue tongue is in the wildlife, it's in the environment, there's not a whole lot, there's probably a cost of doing business.
BVD virus, this chart up here, Dr. Grooms in his paper, so it can cause infertility, it can cause embryonic loss, it can cause immunotolerance, which in fact the calf is born PI tolerant to BVD. It can cause abortion, it can cause congenital defects, and then the calf could actually in fact be born normal with BVD titers if he's been exposed later. So there's a lot of different things that BVD can cause. This actually is a Dexter donor cow that was bought by a grass operation, and they didn't have a vaccination program. Her beautiful heifer calf is a PI. So they bought a Dexter cow, donor cow. You wouldn't suspect a donor cow to be a Trojan horse for BVD, right? Well, it turned out to be that that beautiful heifer right there had to go to slaughter because there's no way to salvage those genetics. Nice heifer for sure. Risk factors, there is a BVD consult online that you can go and you can look at to see, do you have BVD risk? BVD consult is a great place to go by Kansas State. Dr. Brad White and Bob Larson there have developed this, and it's a great thing. You go through, answer some questions, and it goes through a series of, so it's certainly something to recommend to visit there. Bovine herpes virus, or IBR, infectious bovine rhinotracheitis, can cause a variety of things like BVD. Can cause a failure to conceive because it affects oocyte quality, it affects luteal function, can cause abortions up to 100 days post-exposure. A lot of times these calves are autolyzed. They died and it took a while to abort the calf. So there's some autolysis and histopathology. Looking at the tissues under a microscope can tell me that. This virus has the potential for recrudescence. What that means, it can hide in the trigeminal ganglia, trigeminal ganglia nerve bundles, and then it can come out through periods of stress. So it's a herpes virus, and herpes viruses behave that way. There is modified live vaccine-induced abortions. If I use modified live in naive cattle, I have a risk of that. Not everybody's going to abort, but certainly potentially quite a few. And then the diagnosis is going to be histopath. We used to say that viral isolation or BI was the gold standard, but it just takes a while sometimes. And sometimes we find a virus that just doesn't like the cells that we use in viral isolation culture. So we may miss it in fact, but autolysis of the fetus is common. We do have PCR to detect the virus antigen. And then histology is very, very good because there's some pathognomonic lesions that can be seen by microscopy, multifocal hepatic necrosis, as well as inclusion bodies. So it's a great tool if IBR was involved in the abortion. A lepto abortion can occur throughout gestation. Cows get lepto from each other. They get lepto from an infected bull. They get lepto from the environment. There's 5 common serovars. This is L5 in our vaccines, right? So the 5 common serovars, the one that we typically talk a lot about is hydrobolus, but pomona occasionally raises its head. It is adapted, lives in the kidneys of cow very quietly for the most part, during a stress event. Then it raises its head and does its thing, and then goes back in hiding again. Can be shedding semen. It does interfere with conception. It can cause abortion at any stage of gestation. When I do the test, forgive me that Dr. Patty Sharko mentioned that maybe you don't have a grip on that hand when you're collecting that urine sample. And what it was down here is zoonotic. I do know people that have been infected with lepto, and it's ugly in human beings. It really is. Actually, diagnostic lab diagnosed one of the teachers at high school. So who wrote for veterinary medicine and human health, right? But anyway, you get Lasix, and then you collect the midstream, and then you look at it, and you can do fluorescent antibody or direct microscopy on the sediment, and hopefully you can find these to demonstrate. Serology is not rewarding. That mentioned in a vaccine, L5, I've looked at titers, and there is no rhyme or reason why a cow is going to respond to one leptoserovar versus another. I can look at 10 titers, and one might respond well to Harjo-bolus, and one might respond well to Pomona. One of them might respond well to Canicula. That varies. And so titers are just not rewarding, and they're very, very, very difficult to interpret. Vibrio, this is something I haven't seen at the diagnostic lab in 12 years. Perhaps maybe vaccination has done a really good job. This doesn't mean it's necessarily not out there, but we look for that organism in fetal fluids. That's why it's really important that when you do a diagnostic panel, you get the fetal fluids from the abomasum of the calf. A true stomach can be seen in some of the fetal membranes. Culturing bulls is difficult. And the treatment is we're going to vaccinate the bulls or cull. Neospora caninum, it's in the environment. This happens when a canine or coyote maybe contaminates the feed. We did have a situation where some coyotes had contaminated some feed. It was baled, some baleage, and then they fed it to a group of Holstein heifers, and they had an outbreak. This is not contagious. This is not one of those things that's going to spread unless you actually spread it in the feed. So if we have an outbreak of multiple animals, we're going to be looking at some of the feed practices on the farm. Bluetongue and epizootic hemorrhagic disease, it's in wildlife and deer. Those are spread by midges, culicoides. This can do abortion, mummification. I did see a calf like this. It actually resembled curly calf disease. I did see a calf like this in my neighbor's farm recently. And of course, there's nothing much you can do there with that. Anaplasmosis has caught a lot of attention, in the last 5 or 6 years because it got spread throughout. 12 years ago, when I went to the University of Georgia, we didn't see anaplasmosis. We began to see it about 2012, 13, 14, and now we see it on a regular basis. And so it's definitely a recognized cause of abortion. Had a phone call from a Hereford breeder, and he said, every year in the fall, August and September, and our falls, for whatever reason, even though the temperature might not be hot, that sun can be really brutal and have high heat index. He said, we always have 5 or 6 or 7 abortions. So this year we had about 9 in these Hereford cows. I said, well, did you lose any adult cows? No, they appear fine. And so that doesn't play right. That's not the typical presentation for anaplasmosis. And I said, well, it doesn't quite sound like that. There's some parts missing, but let's test for it anyway. And all the cows were anaplasm positive. And so sometimes we're looking at behaviors of the bugs. How many of you are veterinarians in here? How many of you get to the Animal Health Smart Brief that comes out through email? I don't know if you know this, but there was a bunch of parvo dogs in Michigan, I can't remember, but they were tested negative for parvo. So sometimes these bugs adapt and they don't behave. They take on unique behaviors. And we just as veterinarians, sometimes if it walks like a duck and quacks like a duck, it's probably a duck, even if it doesn't look like a duck. So we just need to pay attention because some of these things, some of these viruses adapt and they mutate and they have really incredible, simple as they are, they have incredible mechanisms for circumventing our prevention practices, our bugs and drugs and vaccines and stuff. And some of these bugs are adapting. So it's important for us to keep an open mind when we look at these things. So the way anaplasmosis works is it causes anemia. It's a cycle. We get a destruction of red blood cells. So there's an anemia. There's a marginal hypoxia, which the cow can probably compensate for, but the calf can't. So when that calf gets hypoxic, it gets stressed in late term in the last 8 to 9 months of gestation. It gets stressed, and when it gets stressed, cortisol levels go, and then that triggers abortion. That triggers a stillborn calf or a very, very weak calf that's premature. So anaplasmosis is identified through ELISA. We can look for the antibody, or PCR, which actually looks for the organism. And then the fetal spring, if I'm looking at the fetus, Kansas State, their work has shown that the fetal spring is the place to look for it. Not always can we find it in the fetus, but it's the place to look for it. Trick. Trick is a single-cell parasite. It lives in the prepuce of mature beetles, sexually transmitted. And I spoke with Dr. Owen Ray at the University of Florida,
And he feels like in days the reservoir is actually infected cows, and probably is in the beef herd in Florida
in those extensive operations than in infected cows. Had a conversation with a veterinarian last night, and I have been told that occasionally trick can actually survive a pregnancy in a cow and persist in that cow in the reproductive tract of a cow. Because there's some places within the cow that have a similar environment, an anaerobic environment at the reproductive tract, so it can be there in the cow potentially. So the bull breeds the cow, gives her a dose of semen, gives her a dose of trick, and then about 50 to 60, 75 days later, that trick's replicated, causes inflammation, causes infection, slips the pregnancy, and the cow breeds back. She has short-term, short-term resistance. This has been documented over 30 states in the United States, and of course there are other species of trick. Some of the non-infectious causes, how am I doing on time? 5 minutes, oh goodness gracious. I had so much to tell y'all. All right, let's keep going.
Vaccines, we use vaccines as one part of the health program. It does stimulate cell-mediated immunity. There's a lot of evidence, and I'm going to skip that part. I think this is something that I think is pretty cool, especially when I talk with veterinarians. When we look at the immune system, we've got the innate and what's called the natural immunity, and then we have the acquired immunity, and that's made up of the human part, which produces antibodies, and the cell-mediated part, which produces killer cells, T cells, lymphocytes. And so what we would like to do if we're producing the optimal protection for our cows is get that immune system hitting on all 8 cylinders. And so to do that, I think it's really important to think about some studies, and I'm just going to skip them, and I apologize for that. Some really good studies came out of Auburn. Even goes back to Dr. Grimm's study looking at vaccinating calves with both a killed viral vaccine as well as a modified live viral vaccine, and showing some antibody responses. Yeah, antibody levels don't necessarily always a perfect prediction of protection, but they're a really good measure for the immune response. And so that's something that I think that I want to kind of skip. This is something I think is important to understand. As producers, when we talk to producers, we think, well, I gave them a shot. Everybody responded, right? No. The reality is we get a handful of cows that respond really well. We get a majority of cows that have kind of an average plus or minus response. And then we get another handful of these knotheads that just don't respond at all. And we don't know why. They might respond the next time. And that's why we recommend getting the modified live. We're giving a reback, because with modified live, if I get a good response, I don't need to come back with a second dose of modified live. I'm revaccinating with a modified live so I can get these right here that didn't respond the first time. And then I only get a percentage of them. And that's why we recommend 3 doses of modified live in the life of that heifer before she's bred, so that I can get her pregnant, or 2 doses in that steer before he goes to the feed yard, because there's really good evidence that shows that that's a very solid vaccination prevention program. Why don't we work? It's the vaccine's fault, right? No, it's not. We got the vaccines, how they're handled. There are lots of things that go with that. We got the animals, were the animals healthy? Were they on a good nutrition program? And we got the humans. We always have the potential to screw something up because we have humans involved. And so it's important to understand that. And not every animal is going to respond to vaccine. 100% response isn't really possible, and we should never expect that. This was a shipment. I used some autogenous. This was a shipment of autogenous that arrived at about 60 degrees Fahrenheit. They were a steep producer. They had a thermometer, and he stuck it in one of those, and he said, "Hey, what are we going to do here?" So anyway, fortunately, the company sent us another shipment. Really good. One of the things that we don't worry about it. We want to manage it so we don't have to worry about it. But if we manage our herds properly, and the veterinarian and the producer are on the same page, and we're making good recommendations, is that we can effectively use modified lives with very, very low risk in our herd. Matter of fact, we need to be using modified lives. Really good evidence from Auburn shows that straight kill program does not cut it. I'm not going to go into the details
because Dr. Cummins informed me that I'm long-winded. No, I'm kidding. I'm not. I'm picking on you. So with this, and I did steal this from Multimin. I do a little bit of moonlighting for them, but I do want you to show something. Sometimes the response requires a lot of nutrients, and when you give that vaccine, think about the immune system is going to compete with the reproductive system. It's going to compete with other, because I have a set amount, scarcity principle applies. I have a set amount of nutrients circulating in that animal, and then the systems are kind of sharing, if you will. I don't think there's a democratic process in there at all, but a cooperative process anyway. But they're sharing, and then I give a dose of vaccine, and I say the immune system needs to respond to this vaccine. What is it going to do? It's going to suck all the nutrients to itself to use those, and so it's going to deprive the other systems. And so if I've got an animal that's imaginary, I give them a vaccine and I expect them to respond, they're going to pull things away from others. And so that's going to delay that animal from coming back into heat, going a cycle and getting rebred. So those kind of things, I need to make sure that my animals are not marginally deficient, and that the nutrition is adequate. This was that study that Dr. Paul Wells did, and they used only killed and they challenged BVD, and you can see that this was the control group, and they had such a good, thorough challenge that not a single calf was born normal or all aborted. We only had one vaccine that even protected up to 50%, but a straight kill program, which I see a lot in Georgia and the Southeast, just doesn't cut it. So we definitely need to include a modified line. Let me skip through this part. Apologize for that for the sake of time. Modified lines do provide a stronger, quicker immunity and cross protection with strains. Studies demonstrate superior protection of the modified live combination, modified live and inactive in prevention programs. So a combination of that modified live or the modified live foundation with the kill virus on top of that looks really good, really protective. Modified lives definitely need to be considered in a herd health program for carrots and replacement heifers. And then they need to be designed, vaccination programs need to be designed to maximize immunity and mitigate any risk, because vaccines are not without their risk, but we get so much good out of them that we definitely want to make sure that they're utilized properly. And it leaves up to me and my veterinarian to, in my case, with a handful of small South Georgia herd that I have, it's up to me, but to design a really good vaccination program. Shedding is possible, but it's extremely low. Stress is involved in that. If I have a low stress system in my herd and I'm vaccinating those calves, especially before I wean, before I separate while they're still on mama, I get a really, really good response. And that's what that Grooms and code paper showed. Just real quick, and I'll close with this investigator. So part of the containment is proper investigation of problems. One abortion, is that critical that I jump all over that? No, it's not. We know that there's a lot of causes of abortion and we can't do anything about it. And there's more than 50% of the time, maybe only a third of the time, can I actually come up with a definitive diagnosis of an infectious agent or a toxin like nitrates or something. But definitely want to investigate and possibly isolate. We don't have brucellosis, so isolation is absolutely critical with abortions, brucellosis abortions. So if you happen to be in that neck of the woods where that's potential, you definitely want to practice that habit. Abortions can be very frustrating. Believe me, I've chased a bunch of those. And I really just need to say, okay, do I expect additional losses? Is there something that I want to do initially to start with the malaria test for call to a diagnostic lab? If you're not that familiar with the process of investigating abortions, very, very important. Define the problem. Well, the problem, doc, was she was pregnant. Now she's not. Okay, that's pretty simple, isn't it? But really, was she ever pregnant? was she ever even preg checked? We know that from Dr. Vitor's comment, Dr. Mercadante's comment this morning, 80% of most herds or 80% of herds are actually not preg checked really. And in my neck of the woods, I used 80% because we just don't see that much. We fight over preg checking, but honestly, if we could just expand preg checking, we'd have enough to go around, wouldn't we? So I'm going to have to check to see if additional cows or more than ones affected. Definitely, we need to collect all the material, not just the calf, but we want the placenta. I'll talk a little bit about that. What is the extent of the problem? One case may be normal. I need to look at other risk factors. Have I removed animals from the environment? Perhaps the exposure already happened, like in the case of IBR. What kind of things, whenever I get into an investigation, I'm looking at who, what, when, and where, right? Those are the questions that I'm asking. New additions might be affected, but it might actually be that the new additions were affected by something endemic in the case of anaplasmosis or even BVD. If I bring naive animals into a BVD endemic herd, then they're going to be affected. This is really important because the epidemic dictates to me as a veterinarian my response. And it's also going to affect my recommendations to my producer. Is if something is endemic, it's probably going to be self-limiting. But I can sometimes manage that. If something is sporadic, then I may not extensive diagnostics. It may be something that just happens. That's kind of a gee whiz case. Extensive diagnostics may not give me the answer. This can be something sporadic. There's no pattern. It's sporadic. So there's no pattern. If I can find a pattern, that helps me because I understand pathogen behavior, right? If I understand pathogen behavior, I'm understanding patterns. If I can understand patterns, that helps me as an investigator. Because I'm going to go Sherlock Holmes this thing, it helps me to investigate that. And if it's an epidemic, it's going to be self-limiting, right? It's going to be a fire, it's going to burn itself out, it's going to be gone. I'm going to learn in hindsight because I'm going to implement some security from that. But the placenta is very important because whatever affects that calf has to go through the placenta, right? It is either going to be an ascending up the reproductive tract, it's still got to penetrate the placenta to get to the calf in the case of like moles, Shrek, something like that. If it's going to be something that comes from the down, it's still got to come through the placenta. So the placenta increases my chances of actually having diagnostic results. What do I do? BVD testing clear. Obviously, vaccinate appropriately. IBR, similar aggressive vaccination program. Present test or treat marginality. This is going to be, I'm going to have to live with this one. This term endemically stable, which Dr. Hazelchak has mentioned, even he sometimes says that some of these herds are not stable because they can have environmental stress triggers that causes anaplasmosis outbreak. Lepto, vaccinate, aggressive revaccinate, potentially reduce reservoirs. Listeria, fungus, mycotoxins, that's managing my food better. Not feeding much of mildew, swallow feed, urea plasma, do not share cedars. Urea plasma, the cases that I'm familiar with urea plasma, we use cedars were a component of that. Miaspa, test and color, just learn to live with it. So, the goal of the health recommendation, I apologize that I didn't go through some of it, but hopefully what I did go through was useful. This is something that we can work together and protect your herd. Hopefully you're working with a good veterinarian that stays current, goes to meetings like this and goes to LDP or Society for Theory or ABC, and you implement a really good biosecurity program because that's going to probably take care of about 90% of your issues right there. It's just to keep it out. And then if you don't, if it does come in there, hopefully you've got really good resistance in the herd through a solid vaccination program as well as a good nutrition program. So without a do apologize for running a little bit long. No. But Dr. Cummins, if you want to, I don't know if we
a lot of great information being shared. I would encourage you, if you want more
These guys put together for team, got all this information. So we've got time for a couple of questions before we transition to topic data. So if you've got a question involved, comment. We can share a couple of those for Dr. Jones now. Yes, sir, right here.
Dr. Gray.
You blew by nitrates for that.
Yes, I apologize for that.
The countries are really reliant on these drugs. Talk about nitrates.
All right, so Dr. Ray did point out I blew by nitrates really quickly, and you're absolutely correct. I did. Most of us understand that an important security program is testing our hay samples, testing our feed levels, and if feeds have high nitrate levels, there are things that we can do to dilute out. So toxins, the solution to pollution is dilution, right? So if I have toxins, there are some levels that I can actually safely feed. There's some practices. I think there's some probiotics that I can use. There's different things that I can do, but definitely the best prevention you can do is do a thorough testing of your hay. Everybody in here knows that I can't test every single bale, and that a lot of times one bale might be the hot bale. It happens. But definitely test all the hays. Nitrate levels do go up in stress forages, certain types of grass forages, without a doubt. And so we can get nitrate toxicity. But nitrates, what they do is the animal consumes them, the nitrate's converted in rumen, and then it gets into the bloodstream, and then it combines with hemoglobin, forms methemoglobin, and then that interferes with the hemoglobin's ability to transport oxygen, so that the cow may not experience any outward signs. It couldn't kill her, I mean, that's obvious, but if it doesn't kill her and she doesn't have outward signs, she does experience hypoxia, and the late-term calf that is just, consuming oxygen from mama's bloodstream as much as it possibly can, experiences that hypoxia, and in fact is suffocating, and its response, the cortisol release, and then that triggers parturition, that triggers calving, and a lot of times we see through nitrates loss of late-term pregnancy. Did I cover it, Dr. Gray? Mm-hmm. Good point, because whatever the animal is consuming, we also want to make sure that, and there can be nitrates in the water with drought, because we have concentration of things. We lose water in the water, but other things are concentrated. So especially if we are consuming surface water, there's other things that come from ponds too. Some people, well, there are tanks down here, right? So I'll never forget, I came to Texas in the 80s, and I was looking for Granada genetics in Marquette, Texas, and I wanted to go deer hunting. The guy said, well, go down to this tank and hang a left. I looked all afternoon for that galvanized tank, and I never did see that son of a gun. His tank was an earthen dam. It was a tank, but anyway. But no, it's right. Surface water will have concentrated toxins in it with reduced rainfall, because we do need rain to both recharge and flush those reservoirs out. Good point.
We have that hay that's outside too, and then it gets a lot of rain, and it leaches nitrate and concentrated in the
Okay, good point. Dr. Gale so Dr. Gale brought out a good point that nitrates can be actually, through rain, can be leached at the bottom of the bale. So if you're going to sample, sometimes maybe sampling a portion of the bale at the bottom would be ideal. Yes, there was a question over here.
Using cedars.
There's a comment that sulfates can also be increased in surface water during drought and dehydration. It's absolutely true. So sulfates and phosphorus, some of the nutrients, some of those things will also lead to blue-green algae blooms, and those can be toxic to animals. The other question was about reusing cedars. Anything that is in a cedar, if I'm reusing that, then I can transfer that right to to the next animal. Now, if I'm autoclaving those cedars, then I'm going to kill anything there. But if my practice would be to reuse, take a cedar out of one animal, rinse it off, and maybe dry it off, even put it in another animal, there are places within that cedar. That cedar's 2 layers, and there's actually a space between those layers that organisms can hide in the cedar and be. So I may not just be, using progesterone from that cedar. I might be taking the place of that bull, right? So I'm moving. And I know some people have been concerned about even the potential of transferring trick. I don't know if that's possible. But whatever's in that vaginal vault where that cedar is can be potentially transferred to another naive animal. I'm reusing that cedar.
Thank you all for the questions. Second time, we'll turn this over to Dr. Gale. Dr. Jones will certainly hang around for the end of the session here and for more discussion. But let's thank him for his presentation. All right, over to you, Dr. Gale.
Thank you. We actually had a case when I left last week. A producer moved some cows into a barn lot, and we had nitrate poisoning because they'd left 2 5-gallon buckets full of liquid fertilizer that the cows drank. Okay, you guys, is that good? All right. So just up front, I'll tell you that I'm not very good at sharing, and they put me second, so I've probably got way too many slides also. I've got a couple stop points as we go through, so I'm going to go through just some general biosecurity and management philosophy, and then we'll stop, and if we've got questions, we'll see where we're at on time. And then I've got some individual slides that overlap a little bit with Dr. Jones on individual diseases, and I can go more into what we do as far as actually in our practice. So I'm just here, like through the introductions, I'm here to kind of dumb it down for everybody. So if you have any questions as we go through, just let me know. This is a slide I found a couple of years ago, and so let's see, does this work? Just kind of points out, so, the NOAA came out with a prediction, and just going through it quickly, and you can read down at the bottom in red, the equal chances of above, near, or below normal temps and precipitation. So I use that because sometimes we have a lot of information, and it can be 100% accurate, and it's 0% useful, right? So what we want to do is we want to take, as a practitioners, we got to take the information that's given to us and actually put it into practice every day. I should have been a meteorologist because I can do that. So this is what I try to do every day, is create and protect healthy herds, and that's different for every producer. It's different in every situation. Quote from Louis Perino, was at the Academy several years ago, or at least it was giving credit to him. Relying solely on personal experiences and technology relegates us to the practice of wizardry. Depending only on science and critical evaluations of scientific reports creates paralyzing indecision. So we got to walk in the middle of that someplace, right? We can't just not rely on science, but if we're so reliant on science that we never do anything, then that's not helping our producers either. So just a little story to kind of demonstrate that. So I've been at this now 24 years, and I knew a lot more 22 years ago than I do now. And when I first got out, I bought a small group of cows to add to my cows. I thought, well, I'm a veterinarian, and I know a lot about disease, so I'm going to test. I'm going to test for everything. So I tested for leukosis and Johne's and anaplasm, and I tested for everything, and they all came back leukosis positive, and I'd already bought them. So now, I'm kind of in a pickle. So I called some peers, and I talked to some friends of mine, and talked to Bob Larson, who's at the University of Missouri, and he said, well, what's the status of your current herd before you sell these all past pound cows? So I went back and I tested my current herd, and lo and behold, about 85% of them were already positive for leukosis, which is fairly endemic in our area. So my point being, before we test, we need to make sure that we know what we're going to do with that information, and that we have a useful outcome for it. Sometimes I get requests from producers that are going to have a bull sale, they're going to have a large bull sale, and someone asked if they'd be tested for this or that, and they'll say, well, let's just test the whole herd. And that's fine, and I don't want to be deceitful with what we have, but if we test the whole herd and we test 40 bulls that are going to sell and they all come up positive, well, then we need to have an exit strategy and know what we've just done to devalue the whole herd. because now we have that knowledge and we would know that they're positive. So molecules versus management, this is actually related to BRD and it's somewhat dated data. But the point being is that we've got a lot better tools at our disposal than we had. I don't think anybody here will argue that our vaccines are better than they were. Our antimicrobial choices are better than they've ever been. And yet, if you look at the progress that we've made, we really haven't made any. And I guess I would argue that really that's probably because as an industry managed to an endpoint. So using BRD for an example, if we're buying calves and our goal, we know we can buy high-risk calves and we're going to have 50% morbidity and 5% mortality. So we're going to treat half of them and 5% of them are going to die. And then somebody comes and they give me product X and they say, you can give this off the truck and you'll cut that in half. Well, instead of being happy with that, what I'm going to do as a producer, I'm going to say, well, or I can buy higher risk calves, use half as many cowboys, and still have 50% morbidity and 5% mortality. And I think that's kind of what we do as an industry. We manage to an economic endpoint. And we've also changed our operations. So this is how I got my start, feeding pigs in the family farm. And the operations have changed. So we're dealing with a lot different operations than we were 20, 30 years ago. So in the end, we try to simplify it, and we talk about vaccines, we talk about the pathogen, but what we really have to look at is that interaction. So I think everybody understands that we have the individual animal, we have the pathogen, and then we have the environment that they're in, and those three interact. So we can't only manage one of those. We have to look at it from a systems viewpoint, and we've got to manage all of those aspects. So we can give a really, really good vaccine, and we can overwhelm it. We can have a really, really healthy animal, we can overwhelm it. So we have to be careful what our total system fits like, and one size doesn't fit all. So the paradigm being that if you have a pathogen, you have a disease, you have economic loss. So you eliminate disease, you have economic benefit. Well, reality is not that simple. If it were that simple, then I know with trick, if I had an individual cow with an individual bull and an individual pasture, I probably wouldn't have very low risk of trick. But in my operation, it's not feasible for me to have a cow for each individual bull. It's not feasible for me to take each calf and wean it in an individual hutch. So there are things that we do, and that's oversimplistic, but what I'm trying to emphasize is that we have to look at the economic cost of what we do. And often you're looking at suboptimal performance, not necessarily black and white answers on things that you have to have good records to know if they're there or not. Basic immunology, so to that end, you have vaccination, the act of just giving the vaccine. We have immunization, where we actually get the animal to respond. But in the end, what we really want is we want protection. And that means that the animal's immunity is greater than the challenge that it's offered. Some examples I give of that. So we have different vaccines that we use, and we have different expected outcomes. With rabies, we hope to have complete protection. Obviously, we're not vaccinating a lot of cattle for rabies, but it's a good example of where you get complete protection. And we're going to talk in a minute about individual versus herd immunity. Partial control disease, really with a BRD vaccine, you look at partial control. Pink eye, sometimes I think if that vaccine works at all, it's just decreasing the severity of the disease. And we have actually used a little bit of anaplasma vaccine and feel like it also can help us there. There are diseases that are I probably have a lot of BVD in this talk, but there's diseases like BVD where BVD vaccine by itself is probably going to give us partial control of disease. But I can do just a few. BVD is a great disease because I know a lot about it and I can take specific steps to get rid of it. So if we diagnose it within a year, if you'll do what I say, it can be gone. So all we have to do is put in a few management practices, and we can take it from something where the vaccine was giving us partial control, where with vaccine and management, we can eliminate it from the herd. So I'm gonna just skip through that. So basically, each dollar spent needs to make us $1, right? We're all in this. We're not well, some years we are, but mostly we try not to be non-profit organizations. So herd health, simplistically, is keeping the protection and immunity above the level of disease challenge and having the healthy herd somewhere in the middle. So I'm going to talk a little bit just briefly about R0, or reproductive rate. How many people in here are familiar with that? I know we have a few veterinarians, but producer-wise, is anybody familiar with reproductive rate? So I know it's a reproductive talk, but I'm talking about this in a different sense. We're talking about the spread of how fast a pathogen can spread. So what we're looking at with reproductive rate is we need it to be below 1 to get something to stop spreading through the room. So what I want to know is if I have the flu and I sneeze on this table, are Dr. Jones and Dr. Cummings both going to get sick? Or is less than one of them going to get sick? So if we can get it below 1, then we can stop the spread of disease. Just some busy charts, but back to our BVD example. So we think the R with acute infections is about 2.3, but the R when you have a persistently infected calf is about 35. So that makes a big difference. So we can do a lot with management changes. Is everybody in here familiar with what a PI is, the persistently infected calf? So that's the animal that is born with BVD, always has BVD, spreads it throughout its life, and it's the real root cause of having BVD in your herd. I think I might have some slides coming up on that. So we're managing clinical disease. We have subclinical disease often is our hidden factor, our hidden cause that we need to look after. So individual immunity versus herd immunity. So I don't know if you guys are aware of it, but there's a couple of years ago, there was a coronavirus that originated in China and came through the population. Anybody remember that at all? Yeah. Yeah. What it blatantly pointed out to me is that the CDC doesn't have any idea what herd health is. But we deal with it on a daily basis. So individual immunity is the induction of protection against disease in that individual animal, reduce susceptibility of an individual against infection, reduces the infectivity after the occurrence of infection in that individual animal. On a herd level, it's a much different phenomenon. We're reducing the probability of an individual becoming infected when it's part of a vaccinated population. The chance of becoming infected in a population decreases with the increasing density of individuals being vaccinated. So if you have vaccine and you actually have an immunization, then we can get protection and basically get that R0 down low enough to where it's not spreading through the herd. Prevent transmission of the pathogen within the population is our ultimate goal, right? So back to the reproductive rate of BVD with a PI or without a PI. So if we have an acute infection, then we only need our vaccine to be about 57% effective. So Dr. Jones talked about if we go through and we give vaccine to 12 animals, I think you had 4 on your slide or 5 on your slide, but if you have 12 animals, you're gonna have some that are really protected and some that are kind of protected, and some that missed the boat. They weren't there that day, or we thought we shot that one and we missed that one, or they just didn't respond, or for whatever reason. But we only need about 57% of the herd to respond. Well, if we give 2 doses of modified live, we can get well above that. But if we have a PI, if you look at different mathematical models, you've got to have 97% of them have a good rate of protection to try and get past that pathogen level. So again, different things we can do to help manage our way out of things, but we have to look at it from a systems viewpoint, from multiple viewpoints. We do, just as a side note, and I think I've got slides in here later too if I get to them, but we do too use a lot of modified live vaccine, and I've got multiple years of data in our own herd where we've AI'd for multiple years. Every cow gets AI'd, and we give our modified live vaccine when we put our seeders in, and our conception rates are what I consider well above average. So we're believers in modified live vaccine there, but that's again a operation decision, and we have some where it's just not, we don't feel like it's safe for whatever reason, and do use some killed vaccine, but that's when they're primed. We try to get them primed with modified live. Vaccine handled improperly, something that we have to pay attention to. So a couple of years ago, I was at a farm for the first time. We're going through the office, going through the refrigerator, just talking about things. His modified live vaccine was on the shelf, already mixed up from days ago. Yeah. So we had the conversation that, you have about 2 hours, 90 minutes or whatever, and we try to get our producers, unless we're in a feedlot environment or something where they're lined up and rolling through, we usually even use 10-dose bottles, just so that we can minimize the amount of time that that vaccine sits in the bottle. But I had another story along those lines where a pharmaceutical rep told me when the modified lives kind of first started, he went to a producer and he's bragging how well they help. And this probably isn't good for the pharmaceutical companies, but the guy said, well, the vaccine is working really well, but how do you get that little wafer out of that other bottle? So wasn't even mixing them up. But we do utilize coolers, and we've got some fancier ones now, but originally made these styrofoam coolers. So in Missouri, we get to suffer both the extremely hot summer and extremely cold winter. So, our temperature goes from 20 below zero to 110. So we'll put ice packs in it in the summer. I think probably just as important, if not way more important, is keeping it warm in the winter. So if when you're going to vaccinate, your syringe, it's frozen in the needle already, and you got to go lay it on the dash or stick in the exhaust pipe of a running truck to get the vaccine thawed out, then you probably need to change your management strategy. Seen all those things. Stress, sometimes animals won't respond to vaccine because of stress. Handling facilities, which I think as an industry overall, and at least in our area, have gotten much, much better. And some of that's just due to consolidation of herds and larger herd sizes. But the handling facilities that we see now are way better than they used to be. Limit gram negatives on vaccination. There's pretty good data out there that as we stack more and more gram negatives, we can get less optimal immune response. 3 seems to be the magic number that everybody's settled on. Good sanitation, do not re-enter a bottle. We try to put a new needle on every time we go back in a bottle. As far as washing syringes, we don't wash them with dish soap. Try to be careful how you wash those syringes, and we mark individual syringes for individual vaccine. We have to look at our animal, dietary transition. I know there's times of the year where we're handling them and we're bringing them in, and they're going from one ration to another ration. They're coming off of grass and they're going to a feed lot, or they're leaving dry lot in the spring and headed out to grass. I know there's also been some work on conception rates and the effect on that, changing that right when we are in the process of breeding. So we try to pay attention to all those things. Again, handling facilities are important. I think handling facilities might be most important because the reason, number one, people don't process their cattle and don't do what we ask them to do is because they don't have handling facilities. We'll skip that. So basically just trying to not, again, overwhelm. So the other reason it can fail is because we overwhelm them with just too much of a disease challenge. I chuckled earlier because the solution to pollution is dilution, right? And we know that from the Sandhills calving, if anybody's familiar with that. I mean, that is the perfect example of what we can do with just some management changes. So anybody that's not familiar, in a simplistic form, the Sandhills calving is you bring your cows in, you calve for 7 days, you take all of your cows that have not calved, move them to a clean environment, keep doing that. And you can virtually eliminate calf scours. In our world that we live in, trying to balance the perfect world with our world, usually it's not quite that clean, and oftentimes we're moving the pairs out, which isn't ideal. But in a pure Sandhills calving, you can simply eliminate scours. So the BVD PI challenge is the other one that just completely can overwhelm the immune system. So a long time ago when we had the mad cow. We had the mad cow. I've been around long enough, I remember that in late December 23rd, if I remember right. I was talking to somebody and we were talking about the testing at that time, and they said, well, what everybody wants is they want it to be cheap, fast, highly accurate. So usually you can only get 2 of those 3 things. And I've learned I can apply that to a lot of things. You know, where everybody wants low price, they want it to be highly effective, and they want it to be easy. Well, we sit and talk to our producers a lot about it's hard to do all three of those things. You know, often it's two of the three, but to get all three of those things together is usually not practical. So that was my very quick, I don't know how long that took, Dan, but that's just kind of a quick philosophy on, yeah, so we're good. So I just take a couple questions if anybody has any questions over any of that or what we do, and then if not, we'll kind of look at some individual diseases. Yeah, so Mannheimia, Pastorella, brucellosis vaccine, Histophilus. Oh, absolutely. We're talking about the stacking of gram-negative vaccines. So there's pretty good research out there that says if we stack too many of those gram-negatives, we can overwhelm the immune system. And I'm sure there's a lot more complicated answer than that. But basically, we can decrease the immune response to our other vaccines. So we try to minimize the number of gram-negatives we're given to an animal at one time so we can maximize the effect of those vaccines. So sometimes we'll spread those vaccines out. Again, that's hard. You know, we've got herds that the cattle are coming through multiple times, and we can say, okay, we're going to give these vaccines here, and we'll give these vaccines here, and now we're only giving 2 gram-negatives and we have others where they're coming through once, and that's your shot, right? So yeah, so then you just have to decide, you know, what are our most important vaccines, and how high of a level do we want to go with that. So, all right. So I've just got a list, and I'm not going to go through the guts on these slides because a lot of it is very repetitive of what we already went through earlier. So, but just quickly going to go through 4 or 5, and I can kind of give you a brief idea of what we do. So IBR, you know, when I started, we thought we talked about gram-negatives, we took it out of our vaccine programs a long time ago because I thought it was a made-up disease. I mean, for like 15 years, never saw it. And then now in the last 7, 8, 9 years, we see a lot of it. But that was one we pulled out of, especially on receiving cattle, because we didn't want to stress them out, and we felt like it, A, wasn't very effective, and B, it was hard on the cattle. And now I almost put IBR in that category. I don't see it. I'm not pulling it out of my vaccination programs, but it's just not something that we diagnose. BVD, on the other hand, we do see a lot of it. It can be a major cause of respiratory disease, major cause of reproduction disease. We recommend that people, any replacement animal that's brought in, be it heifers or bulls, be tested as a PI. But what we preach is, and so in Missouri we have the Show Me Heifer program where they test all of those heifers. They go through a very extensive development program, and all of those heifers are PI tested, and then they're sold as bred heifers. And that's great, and that's the best we can do, but it's also important that the producer knows when they're buying that animal, that calf wasn't tested. You know, the fetus, there's no way to test the fetus. So you still could bring in an animal that was highly well managed, been vaccinated, you still need to test. So the new replacement animal is not only the cow. If it's a bred cow, it's the cow and the calf need to be tested. So we do quite a bit of PI testing. Again, we already kind of saw these slides, so. Who has BVD? 3%, if you just do a random, 3% of herds, 19% of a suspect herd. So if you're a herd that we actually suspect that you have a problem, then you've got a lot higher chance. Same way in the feedlot, if we go to the dead pile, chances of finding a positive there are way more than in the pen, right? 93% of PIs did not come from a PI cow, but there are instances where you can't have those cows, and we've all got stories of, I had a producer one time that brought in an 8-year-old donor cow or whatever, and turned out to be a PI. Modified live vaccine, I believe, is very important, and minimize exposure. So that's what we just went through. So we do see trick, not a lot, but enough. You know, the consequences of having a trick positive bull are pretty high. So, and now it's actually regulated in the state of Missouri. So any non-virgin bull that's changing ownership has to be tested. We do recommend, unless you're just pretty well a completely closed herd, we recommend testing when we do our BSEs every spring. There is the possibility of a cow harboring that infection. I've asked, if somebody in the room has the answer, please tell me, but I've asked what that number is, and I've told it's very, very low. I said, well, what's very, very low? Is that 1 out of 100, 1%? Or is it 1 out of 1,000? Or what is that number? Because it makes a big difference when we're trying to figure out what that risk is of having a cow that's propagating that from one year to the next. It seems like we have a lot more trick, so we'll probably need to get set up for it when they have a drought out west and then they ship us all their cows. While I'm flipping through these, one thing, when we're looking up abortions, this is kind of off on a rabbit trail, but when we're trying to research abortions, a lot of times I'll get that call from a producer and I had a cow abort, what should I do? One cow, you know, I don't worry about that a lot, but what I've gotten into the habit of doing is go ahead and collect the samples that you have. If you have placenta, collect it. If you've got the fetus and you got a way to keep it, collect it. And we'll go ahead and freeze those samples or maybe even store some of them, because what will happen, don't ask me how I know, but they'll have a couple more abortions and they don't have the samples. So they found the placenta and the fetus the first time. Now they've had 2, 3, 4 more, and they're like, well, I've got more cows aborting, but I didn't get, this time I can't find it. Well, this time I don't have it. So we've gotten the habit of just keeping those, and then if we need them later, we have them. And if we don't, then we can toss them out and go on with live. I do think with trick, there's probably a huge difference, and you look at the sensitivity and specificity of testing, I think a lot of that is probably collector driven. You know, I think there's a huge technique involved in that, and then handling of the samples. Artificial insemination is a huge way to kind of safeguard against trick. And we do a fair amount of artificial insemination in our herd, and we can argue, somebody wants to argue over a beer tonight, the benefits of AI and commercial cows. I mean, I think it's there, and we do quite a bit of that. I think the problem is when you look at the economic models, it's getting from here to there. Once you have a herd and you're AIing them and you have that efficiency, I think it's economically very sound. The problem is if you've got a herd that's way off on the other end of the spectrum, getting them there can sometimes not be cost effective. Anaplasmosis, again, anaplasmosis can be very confusing, and it depends. So we are not too far north of the I-70 going down the middle of the country, and it depends on, we practice 2 hours one way and 2 hours the other way. And from the top of our practice area to the bottom of our practice area, there's a huge difference in anaplasmosis. And if we want to deal with it and just let it be what it is in a sense and let those cows be endemic, or if we want to try and clear them and have naive animals. Definitely, you know, in the southern part of our practice area, you don't want a herd that's naive. We've gotten to where we do, looking at constant rate of CTC, we actually try to pulse it. We'll do 30 days on, 30 days off. Some of that comes from Hans, where he says he's starting to see some resistance. And also the fact that we don't necessarily want to clear those animals. So we don't want to put them on it year round, 365 days a year, and actually clear and have a naive animal. Then you have animals, you have consumption differences, you know, have lots of different things there that can get that animal in trouble. The other thing is, I think is probably most important, is tick control. What we know in general is if something transfers blood from one positive animal to another positive animal, 1-to-1 transfer, we know that's important. You got to take care of that. Tattoo guns, try and control flies, but what's probably a bigger spreader is the tick. So when ticks take it in, it can actually amplify within the tick. So a tick takes one bite, and then it amplifies, and then when they bite the next cow, they're sending multiple organisms back into that animal. This is a huge cause of abortions for us in fall calving cows. So we're probably 30–40% fall calving cows. And I know Dr. Stegman's here, who's not too far from me. I see a lot of abortions in August that I blame on anaplasm.
Minutes here, but I want to ask you a question going back to BVD. How do you guys test for BVD in the cow-calf herd, and what's your timing? You can talk about the PI specific.
Sure. So we talked about the PI is the animal that we, most drastically want to eliminate. And so it's important to remember back to, we said, hey, that heifer can bring in a PI, so we test the heifer, and we still haven't tested that calf. So on a cow-calf herd, we want to make sure that we've tested and have our results back, and if we, God forbid, have one, the animal's removed before breeding. Yep. So and if we have the charts in there that show, our infection is in that 40 to 120 day range. So ideally what we do is if, a cedar insert, if it's an AI herd, or, before the bull would ever go in, we want to test those animals and get them out of there. So BVD, the testing for BVD is somewhat frustrating, because oftentimes the people that will test are the well-managed herds that probably don't need to test. And then you've got the not well-managed and are probably the suspect herds that are 19% of the population that has it, and you can't convince those people to test. So, and that's probably not important right now. So we do a lot of that in-house, and what I have found, especially on receiving cattle, is we oftentimes, it's reported to us as a black and white yes or no, but on the ELISA, it's a color grid, and we can tell a lot of times. The girl runs them for me, Leo, will say, hey, this one we probably need to isolate for a couple weeks and retest, and they're just really hot, acute, and they'll clear. Probably the last one, if it sounds like we're running out of time, is Neospora. We see a fair amount of that also. Unfortunately, it's one that we just kind of have to deal with and work through with management. So the biggest thing is it's passed by canines. So, that's why it ran rampant in the dairies for a while, is because the TMR is a great way to spread that. We have a fair amount of cows, beef cows, that get fed in the winter with a TMR. Just trying to manage it and not, if you have positive ones, get them out of the herd so they're not putting infected material back out to the population. As far as testing, we have to be very careful as far as just testing cows, because somewhere, I don't know what the magic number is, but probably 70% of the cows in Missouri are positive for Neospora if we just go to test titers. So getting a cow, if I have an abortion and a cow with a positive titer, if I have a cow and then I have calves pre-colostral with positive titers, or I have, an aborted fetus and I can send off tissue and prove it, then if I can put the two together, then I can be fairly confident. So I think I'll just wrap it up there, and that way if we have any questions, we can take questions. And
yep, we certainly won't stand in the way of you all on lunch, but appreciate that. Any questions? Yeah. Another couple questions. You both talked about anaplasm quite a bit, including the abortion part of anaplasm. Do you have an answer? Do you think you can maximize reproduction? What is anaplasm for reproductive inefficiencies?
Besides abortions, Dr. Jones might have a better answer. I would say from my practical standpoint, we don't see that, or at least we don't blame it. We don't blame those. I'm sure there's some effect, but what we see with it mostly that we blame it on would be the abortions. And then, you have the cows that sometimes in the summer even look like respiratory cows. So we'll have adult cow death, and abortions would probably be the two biggest things that we see, but I'm sure anything that's your thoughts.
So good question. Yes, if you have an anaplasm endemic herd, you can use the word maximize. It might not be the same level in that herd, but if we understand that we're anaplasm, we're going to change some management, we're going to change some needles, we're not going to spread it we're not going to contribute to the spreading of it. But yeah, the biggest thing I think that I see
other than the occasional adult loss, is just the abortions. And then how we manage that, you know, as Dan mentioned, we see more abortions in the fall because it's a combination of an environmental stress plus maybe a short-term anemia, which the animals do compensate for. They will have a regenerative anemia, but maybe looking at managing a lot of those herds for more spring cows, because you're going to have less abortions in spring calving cows because you just don't have the same circumstances, that kind of the additive circumstances that come together to create that abortion and that cow death. So, you know, that there are things that you can probably do, but that to say, are we going to maximize our reproductive efficiency? You know, yeah, I think we can, but it might not be the same level of reproductive efficiency of a completely clean herd. Does that answer your question, Dr. Gray? I mean, it's a bit, I think both of us are standing here, you know, anaplasmosis is one of those things is if you understand it, it hadn't been explained to you very well. Sorry, that was my attempt at a joke. But anyway, not trying to be a smart aleck to Dr. Gray here, we're friends. But the fact is there's a lot of this stuff that we're applying principles that we know, good infectious disease control principles. We understand how anaplasma is spread in the herd, and so we're applying those things, understanding that our sense of normal is probably going to change and be modified by the presence of anaplasma in that herd. That's a highly qualified academic answer, isn't it? It depends.
One more question, and we'll dismiss for lunch. Yes, ma'am.
In case of abortion-free outcomes, what materials and what's the best breeding for that?
You get the diagnostic labs.
So yes, I mean, some of the material we don't want frozen, but then we do preserve that material in an ultra cold, okay? Because a lot of freezers cycle, they're defrost and they cycle. Huh? -80 is but nobody has that, you know, on a farm. So the best thing to do is to, when you collect them, and then call a diagnostic lab, and then ask, because some of those samples, especially if there's the potential to have another, like, you know, like Dr. Gale said, if we've got another if we suspect something's going on and there's a chance for another abortion over the next few days, then refrigeration is probably adequate. But freezing is typically best. But most of the time with a fetus, I don't want to freeze the entire fetus, because then I lose the benefit of any histology, right? Once those tissues are frozen, they're damaged, and then their value under a microscope is nil. So some of that stuff, if I'm working with it, some of that stuff I might want to just put in some formalin. And most farmers don't have that, but hopefully their local clinic does. And if we can collect samples, we may not submit them yet. Like that's a very practical approach. That help?
That's usually what we do, is we'll freeze some, we'll put some in formaldehyde and just have them bring them in, and we'll keep them for them, knowing that some of the samples probably aren't optimized that way, but we still at least have them.
I have one more thing. In the last phase of their proceedings, they do have an appendix that has genetic samples and how to preserve those. So kudos to you guys for putting that together. On behalf of the task force, let's thank Dr. Gill and